My name is Sandra Cunningham. I was having a lot of extreme tiredness, but I have a history of thyroid disease, so it was really easy for me to overlook symptoms because I was always blaming my thyroid. One morning, I was taking the dog to the vet, and all of a sudden I started having just like if someone's taking their hands and just pressing and moving their hands from my jaw. And I had had that same feeling like the week before, but I just kind of ignored it, thought it was stress. So I turned around and went back home.
My mom, was having symptoms of things, and you probably wouldn't necessarily think that those symptoms would lead to a heart attack or heart problems or anything like that. So a lot of people are unaware of that. I always tell her, she's always putting us first as her kids and her family and everything. So it was time to put herself first. And I took her to the hospital.
I came to the emergency department at Trumbull Regional Medical Center. Before I knew it, I was hooked up to all kinds of things. After 2 days of solid testing, they revealed it wasn't a thyroid issue at all. It was actually my heart had a blockage. It was actually an 85% blockage on one of the main arteries on the front of the heart. And I ended up with 2 stents. Dr. Nador did the procedure where he inserted the stents through my wrist. It was such an easy process. So literally 3 days and I was home. 2 days of testing and then 1 day and then I was home. The procedure was so easy, I think with a matter of a week or so you couldn't even see the little spot. I was just amazed that they could do such a major thing through a little hole in my wrist. After a period of time, I was worked into the cardiac rehab. I was kind of hesitant about going. I remember my first day of being there, it's like I'm looking around and thought, how did I become part of this club? Because you're just kind of like, one day I think it's my thyroid and the next day I've got a stent in my heart, and I just couldn't wrap my head around it. But then the staff all came to me and just made me feel so at ease, and we started to work.
Sandra came to outpatient. She was different than a lot of the patients that we have because she had a history with exercise, and she was kind of aware of her nutrition habits. For us, for her, it was more about just fine-tuning what she was already doing so that she could learn how to do everything most effectively for her treatment. Every patient's different, so at cardiac rehab, it's not cookie cutter. Every patient's not given the same exact treatment. Yes, everyone's given exercise, everyone receives nutrition education, we assess for depression, and we assess their quality of life. But the way that we continue to follow up or follow through with that patient is different, and Sandra's a really good example of that.
I would highly recommend Trumbull Regional to anyone that was having any kind of cardiac issues. I just can't say enough of good things about everybody there.